If you're about to start your internship, or you're in the middle of your internship, or you've just finished it, you might be wondering whether or not it would be accepted by the General Medical Council. Whether or not your internship is accepted plays a big role into the type of registration that you get, whether it's provisional registration or full registration. So that's why it's really important for you to know the types of internships that are accepted by GMC's acceptable pattern criteria.
If this is the first time you're checking out our channel, welcome. Basically what we do is we run a website that's totally free known as roadtok.com, and it will explain the ins and outs about everything related to the United Kingdom and what it takes for you to work as a doctor in the NHS. So if you've not already, please stalk us on all of our social media. Find us on Facebook, find us on Twitter, Instagram, and of course, YouTube. Don't forget to subscribe.
Hi everyone, my name is Ibreez and I currently work as a doctor in the NHS. And you first might be wondering, okay, well, what is an internship? Your internship is the experience that you get after you finish medical school. And it's really important for you to understand, first of all, if your internship is considered a pre-graduate or a postgraduate internship, because this plays a lot into the type of registration you'll be applying for later on and when you can apply for registration. So, as stated in the name, pre-graduate internship, it means you get internship before you graduate. So if you don't complete your internship in your country, you aren't considered a graduate, a medical graduate, and you don't get your medical degree. You're not considered done. So if you have a pre-graduate internship, you will find this out by speaking to your medical college or your local medical regulatory board. The other types of internships are the postgraduate internships. This means you can technically graduate from medical school even if you didn't do an internship with that medical college. You could go do your internship somewhere else, or you just don't do your internship at all, but you get your medical degree. So your graduating isn't contingent on whether or not you've done an internship. Now, regardless of whether if it's a pre or postgraduate internship, now we need to talk about the length of this internship. So GMC basically looks at it in terms of, all right, you've got a 12-month internship, an internship between 12 to 18 months, and one that's longer than 18 months, or at least 18 months long. Individuals who basically meet the first two criteria, so anything basically less than 18 months, they're looking for you to have at least 3 months of medical rotations and at least 3 months of surgical rotations. Where everyone decides to, get really confused and ask a ton of questions and stress out about is what is considered medicine and what is considered surgical. So I'm just going to make it really simple. If you're not operating on someone, or someone else in that department is not operating on someone, it's not surgical. It's as simple as that. If there are no aspects of anything surgical, there is no theater, there is no OR, OT, whatever, in that department, it is not surgical. So radiology, not surgical. Anesthesia, not surgical. You might argue, but other people are operating. That person is not. The anesthesiologist is not doing any operations. It's medical. Cardiothoracic surgery is, can you imagine, it's surgical. Obs and gynae, also surgical, because there are elements in this department where individuals are performing surgery. So when you are confused and wondering, do you have enough in terms of medicine and surgical, please remember, Gen Med with its allies, so peds, derm, anything else like that, medical. Surgical and its allied, like obs and gynae, guess what? Surgical. You're good to go. Trauma and orthopedics, surgical. You're good to go. Don't stress out too much if you're like, well, is it really considered surgery or is it considered medical? You just need 3 months of it. You have 12 months in your entire internship. For sure, you will at least have those 3 months. Don't also stress about whether or not you've had all of those 3 months in a go. Sometimes people will message us and say, oh, I had 1 month of diabetes and endocrinology, and then I had 1 month of trauma and orthopedics, and then I had 1 month of dermatology. Does that mean I don't have 3 months, in total? If you had that continuing pattern of a surgical rotation, a medical rotation, a surgical rotation. No, you have it in total. When they're talking about it, continuous internship, they're talking about the internship as a whole. There aren't breaks or gaps in your internship, or just that the fact that your internship is for some other reason disjointed or cracked into different places. So don't stress about that. What they're actually looking for is, have you done an acceptable pattern in terms of you've done what your college has asked of you, you've done it in the manner that's asked for you to be done, you've got the correct registration for you to be doing that internship, and you've completed it in the acceptable manner that is accepted by your local medical regulatory board. I think a lot of international doctors just unduly want to stress themselves out and make things more complicated than they actually are. It's not that complicated. For those of you who are completing the 18 months, though, you need to have 6 months of surgical and 6 months of medical experience in your rotations, okay? So it's the same concept as I said before. For those who have less than 18 months, it's the same thing. Don't worry about it. Where you might face a little bit of confusion is, all right, it might say a public hospital, but your hospital is a private hospital. Is that something that's accepted? So long as the hospital or wherever you're doing your internship is accepted by your local medical regulatory board as an organization which is allowed to have a type of curriculum or program that is considered an internship, you are fine. Do not, like I said before, get all caught up into the smaller and finer details that you're not really sure about, and then tell yourself, actually, this isn't acceptable because I think it's not acceptable, and I might as well not even bother trying to apply for GMC registration. All right, because I'm going to say it now and I'll say it at the very end. At the end of the day, it doesn't matter what I say, it doesn't matter what you think, it doesn't matter what anyone else says. GMC is the final authority as to whether or not your internship meets their criteria, and unfortunately, even they will not tell you anything until you are actually in the position to apply for registration. So while yes, there is information out there and we are telling you what we know, it is simply a guideline, so you can have a general idea of what you need to be doing. No one can give you full guarantee outside of GMC. So the things that you can do to at least ensure that you are meeting this criteria is, first of all, what I've already said in terms of duration and the types of rotation. You need, of course, make sure that you've done everything your local medical regulatory board has asked of you. So some countries, for instance, require you to hold provisional registration with the local medical regulatory board. And based on that registration, that's how you're doing your internship. You're registered to work, but as an intern, not doing your own private practice or anything external to that. If your country does not require that, then you don't have to worry about it. But make sure if your country does require it, you have done it, and you submit that paperwork with your internship completion certificate. Those of you who will get really caught up and worried about, well, you just talked about gaps and I shouldn't have, a disjointed internship or anything like that. Please remember, you are allowed to have days off. It doesn't mean that they're expecting you to work for 365 days straight. GMC clearly mentions that you can have 5 weeks for vacation days, for your holidays, for whatever you want to do, and 20 days extra on top of that where you cannot be absent. So that could be for any other thing that might or may not happen. So when you're thinking and looking at your internship completion certificate, you need to look at it and see, is there actually a disjointed period of time that isn't adding up? Is there anything that's showing you have, for instance, more than 3 months gap between two rotations where you haven't done anything in your internship? That's where GMC will start asking you questions. And that doesn't, of course, mean that you will automatically be disqualified for applying for any form of registration. It just means GMC needs to know what's happening. So, beyond these types, the pre- and postgraduate internship, some countries will have a type of postgraduate experience where you might have rotations in different departments, but it is considered a direct post-graduation. You don't necessarily need to do an internship. For those of you who are graduating from countries where this is the case, you need to make sure that it's, of course, at least a 2-year continuous rotation where you're doing 3 months in medicine, and you are doing 3 months in surgery. Again, this is just as I said before, without the interruptions, continuously type of stuff, and meeting the same curriculum requirements as I mentioned before for allied medical and surgical departments. So if you are meeting these criteria and GMC is happy with the internship information and criteria and everything that you submitted, you would get full GMC registration. This full GMC registration would exempt you from applying for UK's foundation program, and with it you can apply for an FY2 standalone, a non-training job, or a training job, whatever you are most qualified to apply for. If, however, you do not meet the acceptable criteria, you will get provisional registration, and with provisional registration you may either complete your internship in another country or in a country where there is an acceptable pattern, doesn't matter so long as you meet the criteria for that country, or you can do your internship in the United Kingdom under the foundation program. Now, we know there are many of you out there who are graduating from countries which will not allow you to complete internship in that country, most often because you are a foreign medical graduate there. That doesn't mean, of course, that you can't go back to your home country, go to the United Kingdom, or any other country that would accept you as a graduate to do an acceptable pattern of internship, so long as you meet the criteria that that country has laid out by its local medical regulatory board, and you also meet GMC's acceptable criteria, you're fine with your internship. There are also some of you who might say, well, hold up, my country doesn't even have an internship. How do I know what registration I will get? We have a video for those of you who meet that criteria. There are some people out there who will be graduating from medical colleges that do not have any internship but will be qualified for full GMC registration on the basis of their graduation. So check out that video if that's applicable to you. Other than that, the most important things that you need to take away from today's video is your internship is really important. It will mean whether or not you get full or provisional registration. With provisional registration, until or unless you complete an acceptable pattern of internship, guess what? You have to do the United Kingdom Foundation program. You can't work in the UK even as a non-training FY1 without full registration. If your country does not meet the criteria for an acceptable pattern of internship, even if it's been however many years and you do not even meet the postgraduate qualification, you unfortunately cannot apply for full registration without completion of an acceptable pattern. And lastly, because you're in an internship, it doesn't necessarily mean you have to be paid for GMC to accept it. But having said that, GMC will not accept honorary posts, observerships, clerkships, clinical attachments, or anything like that as a substitute for an acceptable pattern of internship. They just aren't accepted. So if any of you do have that type of clinical experience but you don't actually have an internship, you're going to have to complete an internship for it to be accepted. They will not accept anything outside of that. Please make sure, of course, that you have an internship completion certificate that outlines the duration of each of your rotations and what rotations you were in. Sometimes we will see that there are some countries who just say, yes, it completed an acceptable pattern of internship, but they don't actually state what. It doesn't mean that your certificate has to go in depth and say you were in, derm, and then you were in radiology, and then you were in peds. But if they at least say 3 months of medicine for this much time from this much time, or 3 months of surgery from this much time to that much time, that's fine. If you're unsure about whether or not your internship does meet the acceptable criteria, guys, like I said, outside of what we've outlined in this video and what GMC has put on their website, honestly, no one else can tell you for sure until you actually go and apply for registration. And while I understand how absolutely frustrating that may be, it's unfortunately the way it is. But as a bit of a reprieve, you could check out our forum, our Road to UK forum, where there are many international graduates and medical students who are wondering the same thing, and you might just come across someone who's graduated from a similar situation as you, maybe the same country, maybe even the same institution, and if they've managed to get registration, there's no reason for you to think that you can't. So until next time, please continue to follow us on all of our social medias, on our Instagram, on our Twitter, on our Facebook, subscribe to our YouTube channel, check out our newsletter, and of course, we'll see you next time. Bye.